Sir, okay, good evening all. Today's episode of Gurukul Pathshala. This time, this is the 5th episode of Gurukul. That's why took one in between growth charts. Now today we are having the expert talk and followed by the quiz by Dr. Prashant KARIYA from all the last 4 and today's episode. So for quiz, all the best to you. And for expert talk, we have Dr. Ketan Bharadva sir, who will be introduced by Dr. Lata. But I know him since a long mentor in IYCF, and as Umesh Khurana sir said, like in Gujarat, IYCF begins with Ketan Bharadva sir. So welcome sir. I invite our president, Dr. Jhankhana Sanghavi madam, for her welcome address.
Thank you, Dr. Nehal. Good evening, everyone. I welcome Dr. Ketan Bharadva sir, all seniors and all attendees. I welcome Dr. Nehal and Dr. Lata also. Today's expert is Dr. Ketan Bhai Bharadva. He is my mentor also. He teaches us a lot. He also, I learned so many things from him also. The most important thing is a discipline I learned from him. And today's topic is a regime changes in today's scenario in the nutrition aspects. It's a really an excellent topic because regime changes in nutrition is extremely needed. Before 10 years back, lunchbox contains only the roti, sabji, and all that. But nowadays, our patients during illness also they need so many new things and attractive things for to maintain the nutrition. So let's welcome Dr. Ketan Bharadva sir for his expert talk, and nothing to say about the quiz. Quiz is always a great aspect of this Gurukul program. So over to Dr. Nehal, please, and welcome Dr. Ketan Bhai.
Thank you. Thank you so much, madam, for the wonderful welcome address. So I invite Dr. Lata Jha, the Chief Project Coordinator, for the further proceedings.
Thank you, ma'am. So I'd like to first welcome our expert who is giving very interesting discussion topic on OPD nutrition aspects. So he's Dr. Ketan Bharadva sir. He is director at Masoom Children's Hospital and has been closely associated with IYCF and Human Milk Banking Association. Sir has so many publications in his kitties and he has been coordinator to multiple N number of projects. Welcome, sir. All the stage is yours now.
Okay. Very good evening to everybody. I really thank the organizers of Gurukul, the president, Dr. Jhankhana Sanghavi, and Dr. Nehal for kindly contacting me personally, Dr. Lata for organizing the things smoothly. And actually speaking, this is a subject to my heart, but how and why did I choose this subject today? It's because once I became diabetic, I have started realizing there is a real great impact of food. And it should start right from childhood. So I have tailored this topic today so that this is almost a futuristic topic for us based on what is going on currently in the scenario of nutrition and diseases. Now my PPT is visible to everybody or not?
Yes, sir. Yes, sir.
Yes.
Fine. So thank you, Dr. Jhankhana, for a nice introduction. Let us go directly to the topic. Is there a need of change of regime? Daily in and out in the OPD, in the wards, we talk about nutrition. But I think now it has to be some very objective thing that we should talk about. Just now, Dr. Khurana in the pre-session talk, just now he called upon and advised us that we need to talk very objectively based on NFHS data, NFHS 6 data. What is there in the NFHS 6 data that would compel us to talk about the change of regime? Before that, let us see that once when I was a resident, or rather almost everybody here who was there resident, we had the scenario of a almost single burden that was that time identified as single burden, that there was malnutrition termed as underweight and kwashiorkor and marasmus, which then changed to underweight, moderate and severe acute malnutrition and chronic stunting, and there were multivitamin deficiencies not identified at that time. And the conventional preaching was that you give energy dense food, and in that way, we used to give a lot of sugary, sweet sukadis and laddus full of jaggery and ghee and oils. They were saturated at that time, but we did not have a lot of data about it. Then came the identification of hidden hunger, and what I tell it as malnutrition or overnutrition. They both have started coming up together. And then we identified specifically the roles of vitamin D. And before that, we came to know the exact role of supplementation of iodine. Iron was known since long, but then more and more insight is coming into iron. B12 was the new thing at that time. And simultaneously, there was increasing observation that some children are going obese also. And now the thing is that we see morbidly obese children also. This was last week. ICMR got concerned about obesity and has given all the guidance for not using the ultra processed foods for schools, including ban on sale of such foods within 50 meters around the school gates. But then, is this thing converting into practice or not? We have to see to it, and we have to see to it that it is being implicated. And now what I see is further a quadruple burden. Apart from nutritional issues, now the toxicities for contamination are seen more and more. And toxicities from the preservatives and all those things, they are now seen more and more. So immunogenic disorders, allergies, atopies, carcinogenic effect of the preserved foods, hormonal disruption, cognitive decline and aggression in the children. These are all new things which are going to worry us. Previously, we had anemia, iodine deficiency associated hypothyroidism in certain areas. We had been dealing with recovery syndromes, plumbism occasionally, and many food associated infections, the diarrheal diseases, typhoid, hepatitis. And now the scenario is changing with improving sanitation and changing food habits and vaccination. Now, still anemia is there, very rampant. How to deal with it, we'll see now. But now we are seeing more of type 2 diabetes, dyslipidemias, hypertension at early ages. Atopy and allergy is on rise. Mental disorders. I don't know. There must be some role of food change habits or food habits change in mental disorders coming up. A lot of ADHD we are seeing, autism now we are seeing, aggressive children we are seeing. I'm not talking of just, low IQ or such developmentally disabled children, but other things which are in the gray zone. PCOD is on rise. A lot of prematurity is on rise because of many reasons, and one of them is malnourished women bearing children. Sarcopenia in adults, early adulthood, which used to be there in old age, now it is coming up in early adulthood also. So these are changing scenarios of food associated issues, and there must be many others also which I'm not identifying just now. And this comprehensive National Nutritional Survey shows all these things. The rampant iron deficiency, folate, B12, A, D, zinc, etc. With again same obesity, diabetes, dyslipidemia. Now, after some identification of the issues of obesity and overall general awareness, obesity is not on rise to that speed in adults. But yes, in children it is there. But then diabetes and hypertension, they are increasing very fast. And these are the concerns for everybody in adults also. And such things, they are now using up our resources. Previously, we used to spare resources for maternal and child health and nutrition and food scarcity. But now, apart from those things, neonatal health, family health, mental health, rehabilitation, food quality, all those things are now using up our resources. And unfortunately, the government is not increasing the funds behind health, funds behind medical colleges, funds behind what is needed for proper health. Anyway, now let us come to certain observations which I had while reading things going on in last few months. This study very well documented that the dietary patterns, they are related to childhood emotions and eating patterns, and they spill over into adulthood. They are related to emotional overeating, enjoyment of the food, and food fussiness. If there is a healthy dietary pattern, which we will describe soon, there will be good. Yeah, there will be enjoyment of the food and real identification of hunger and hunger associated food regulation, and there will be less of food fussiness. But with increasing beverage rich dietary patterns or high energy density patterns, there is increasing food fussiness, and food enjoyment is not there with our children. With protein rich patterns, again, food and enjoyment is going to be there. It is said that old habits die hard. Same happens with diets. The dietary habits established in early childhood remain moderately stable into early adulthood also. This is the TRIP study, May 2025. They have very well established this fact with evidences. And the dietary interventions initiated in the early childhood was evident across all the trajectories of different types of people with different dietary groups, and it persisted into adulthood. That's why now World Health Organization and major academies, they are emphasizing on interventions in childhood eating habits, dietary habits as early as possible. So act early, change the trajectory is the component now going on. Let us start with salt. We all know that the target organ injury begins even with low elevations of blood pressure, hypertension. And the consequences of high salt intake on the cardiovascular system, they are again independent of hypertension also. And our salt appetite is acquired because of our eating habits of salty things since the days of complementary. That's why now we are strongly recommending to stop having added salt till 1 year of age. Apart from that factor of renal immaturity, this is one of the major factors, that the salt appetite should not crave into the preferences of child's eating. And we take a lot of salt, and most of the people, they don't know that already salt is existing in many of our foods, and it is enough for most of our requirements. So starting in the childhood is an effective evidence-backed strategy to prevent hypertension and cardiovascular events is what I wanted to stress here. That hypertension, both systolic and diastolic hypertension, blood pressure can be controlled with salt restriction throughout the childhood and into adolescence and adulthood, along with healthy lifestyle can prevent the onset of the hypertension and then the severity of the hypertension. Similarly, the cardiovascular events of heart attack, strokes, etc. later in the life, they are reduced significantly by even moderating the sodium intake to a moderate amount over the lifetime. That's why the recommendation standard is about less than 1 teaspoonful of salt per day for adults, and for children, even lesser than that. These days, we all know and are worried about formula feeding. And the breastfeeding advocates, they know how much rampant is the formula feeding and uh, how much callosity and insensitivity is there amongst ourselves also in uh, preventing the formula feeding. So right from childhood, the number of children, they are increasing who have got altered basal metabolism. Because of formula, the natural upregulation of genes for intestinal gluconeogenesis is blunted, and ultimately there is high basal glucose and insulin levels, and formula feeds or formula fed children have got a very different insulin response postprandially. Similarly, the branch chain amino acid catabolism is also altered in formula fed children. And ultimately, these children, they rely on the carbohydrates which are given in the formulas which are glucose based, like corn syrup solids, rather than lactose based. And they have other issues also. Say, right from neonatal period, the metabolism in the initial days of life, which should have been fat based rather than that, it is converting into glucose based. And long term impact of such things are there in the adulthood also. And that is diabetes. Nowadays, a lot of things are going about how and why to restrict carbohydrates. Limiting carbohydrate intake reduces the strain on pancreas and improves the sensitivity of the insulin, and thus insulin resistance associated type 2 diabetes is also controlled. The carb restriction would increase the fat and protein, and thus there is increased fullness, less hunger, and helps to burn more calories. Though there is no definition of low carb diet, but deviating from the standard recommendation of having about more than 45 to 65% of calories from carbs and reducing it to less than 40 is actually low carb diet. It may be even lesser than that. But most of the studies, they have been done with a low carb diet of about 40% of calories from carb. And here also, it is the source of the carbohydrate that you receive is very important. And if you restrict carbs and increase fats and proteins from plants, it would definitely lower the type 2 diabetes risk by about 15%. But if you restrict carbs and focus heavily on animal proteins and fat, then it actually increases the type 2 diabetes by more than 35 to 40%. This is really alarming. Nowadays, a lot of people, they are diverting themselves to animal-based diet with carb restriction, and this is really alarming. That's why uh, carb restriction is effective in moderating the diabetes, is being preached by the various associations like American Diabetic Association and Harvard Health Pre-Diabetic Studies also. Now, my recommendations or topic for this today's the lesson for today's session from me is based on this only, that how to reduce carbs and increase proteins, practically in giving nutritional advices to our children in our OPDs. But before that, let us uh, identify the disguised sugars and salts. A lot of uh, products, they are coming in the market telling that we don't have any sugar, we don't have any salt, but then they are sweet. Apart from those artificial sweeteners, a lot of sugar is there with other names like say uh, high fructose corn syrups or fruit juice concentrates or coconut sugar or beet sugar, or there is a big list of it. People, they are confused about the common sugar, the cane sugar, which is sucrose, and jaggery with molasses. They preach to eat jaggery instead of uh, common sugar, but that we have to demystify that. Similarly, the table salt versus rock salt or pink salt or black salt or salty condiments, they should be identified. That is very important. So ultimately, the standard advices for healthy diet for everybody, including children, would be breastfeeding, no doubt about it. All the cardinal advices we have to give, and complementary feeding with wide variety of fruits and vegetables, seasonal vegetables and fruits, other than frozen ones, and healthy protein from the sources of, say, seafood for non-vegetarian people and for legumes and nuts for vegetarians, and other protein sources also, where again animal protein sources are good, but they also have high amount of fat also, and low fat dairies rather than full fat dairies, and lean meats. Again, I told you that with non-vegetarian diet, lean meat should be used rather than fatty meats. You have to remove the fat over the meat. And then minimally processed foods over ultra processed foods should be chosen, limiting sugar, salt, and alcohol. Now let us convert these advices in practice. Before that, let me uh, highlight that now the cardiovascular health is being recognized very seriously. And in US, they found that extended life expectancy has been there seen over last 2 centuries because of many medical innovations and many awarenesses and everything. But still, the cardiovascular diseases are the main barrier to further extension of the life expectancy and human flourishing. That's why now they have come up with a lot of evidence-based programs on uh, diet, activity, sleep, and the caregivers training and behavior. These are few programs named here, like Green Light program, Starting Early program, AAP, evidence-based healthy heart routine guidelines, etc., etc. These programs, they also take into consideration the emotional well-being, and they are all based on that responsive parenting helps children grow smarter, stronger, and kinder. And adding to this thing, we had been here doing a campaign or organizing the movement of parenting for peace. This is very correlating with it. So parenting does lead to kinder children. That is what we have been believing and preaching and trying to train people in this way. So starting from early childhood, using leveraging of the family members and community relations, people, they are now more concerned about relations within the society, within the relatives, which is very fast going off in our society also similar to that in Western world. Anyway, so ultimately for healthy eating, this is a very common thing that we know that WHO has recommended food groups, different food groups, 8 food groups for diversity in the complementary feeding, and daily food from at least 4 food groups should be taken by all the children. And the first one being breast milk, second one is grain, roots and tubers. They are meant for carbohydrates and calories from carbohydrates, legumes and nuts for protein intake, dairy products for protein, calcium, B12 especially, flash foods for all proteins and carbs, more so for uh, high bioavailability of the proteins and good quality proteins and high bioavailability of iron and multivitamins. Eggs, similarly, vitamin A rich fruits and vegetables has been given a special category. This is very important. And other fruits and vegetables are included into one more category. So much is the importance of vitamin A rich foods. And they stress that animal source food should be consumed daily with a strong recommendation, though there are low certainty evidences. And fruits and vegetables should be consumed daily, again, similarly, with strong recommendation and low certainty evidence. And pulses, nuts, and seeds should also be consumed frequently, but when in vegetarian diets, they should be consumed almost daily. This is a conditional recommendation for vegetarians. Now, while going through all these things, I was worried about, say, iron deficiency is so rampant in our setup. So, there is no separate food category for iron. Then it becomes really important for us to identify the iron rich foods, especially in our setups, and to increase them. For that thing, I ran through a lot of data and made this table. Just a minute. Yes. So I think those enthusiasts who are for nutrition enthusiasts or other, everybody should uh, have this table on their table. This is for vegetarian diets. To my surprise, I found that cauliflower leaves, the cauliflower leaves means the leaves which are not in the center thing that we eat, the flower, but the green leaves, the thick green leaves, which most of us, we discard them. They are extremely good source of iron. 40 milligram per 100 grams. And if they are dried, they can be the content increases. And I started eating cauliflower leaves, and I found no problem. And they are tasty also. So we should recommend to our patients about the cauliflower leaves. टर्निप ग्रीन्स, शलगम की जो हम शलगम खाते हैं उसके बाहर के लीव्स कई बार लोग फेंक भी देते हैं, उसको खाना चाहिए. मोरिंगा लीव्स, moringa leaves, they are not very common, though we eat drumsticks, but we don't eat moringa leaves. They are not also available. But then moringa leaves powders is also available. And that is a really good source of iron. Up to 22 milligram of iron is there for 100 grams of moringa leaves, dried powder. And we can just sprinkle that powder in a lot of foods. And it is not a bitter taste. It is almost tasteless. And you can prepare some purees from such leaves also. Then to my surprise, carrot leaf. 9 to 36 milligram per 100 gram of carrot leaf iron content is there. So carrot leaf is a bit bitter. I tasted it. Other than that, mint we eat day in day out. We prepare a lot of chutneys from mint. So those mint chutneys should be promoted. Suwa, sepu, suwa ki bhaji. We all it is available everywhere. That should also be consumed more and more. It can be added to so many other recipes. We all have been propagating green leafy vegetables, especially the palak and cholai, the spinach and amaranth. But I wanted to highlight these above leaves also. Again, why? Because the spinach and amaranth, they may have some varieties may have some low iron also, and only some varieties have got very high iron. There is no uniformity. Then comes the fenugreek. Fenugreek leaves, again, they also have very wide range of iron content. One more thing that is very important is onion, green onion stalks and the buds. The onions, the green onions, when they are small buds only, they should be taken out. They are containing very high iron, and it can be consumed in quantities also. Muli, arvi leaf, we all know. So spinach, fenugreek, amaranth, and mulis, they are routinely advised by us. But now we should start advising all these cauliflower leaves, mint, sapu, drumstick, etc. Now let us see the nuts and seeds. Sesame seeds, the black sesame seeds, they contain 14.5 milligram per 100 gram of the seeds. Similarly, pumpkin seeds, flax seeds, these seeds we usually don't advise to our children. We should start advising them. There are a lot of recipes which can accommodate all these leaves and nuts and seeds. Cashews, children, they happily eat cashews. They eat apricots, they eat pista, almonds, walnuts, peanuts, garibo ka kaju, peanuts. They are having good amount of iron. Black raisins. Nowadays, people they are very fond of, especially in our city. I find that मखाना, fox nuts बहुत लोग खा रहे हैं. ये समझ के कि उसमें बहुत आयन है. आयन ज़्यादा नहीं होता है. It has some good amount of protein also, but आयन ज़्यादा नहीं है. Similarly, people they preach about beetroot. Beetroot में भी इतना ज़्यादा आयन नहीं है. Now, one very atypical thing that I found was garden cress seeds. Garden cress seeds कोई नहीं खाता किधर में. Then I got it from the market. It is usually used by the cattle owners for their cattles, but it has a very good content of iron. And the taste is also good. We can eat it. We can make some shira out of it or kheers out of it. And it is also not bitter, not very bad. And I think if we start giving our children right from childhood, then these things can very well change their lives. Legumes. Most of us, we believe that the red beans, rajma and Bengal greens, chana, etc., it does have good iron. So रोज चना खिलाओ, मूंगफली खिलाओ, लेंटिल्स खिलाओ जात जात के अलग अलग, मूंग खाओ, पर सबसे ज्यादा किसमें मिले? उड़द और मोथ beans and fermented soybeans. Now, fermented soybeans, they taste good, and you can prepare tofu from soybeans, and it is very tasty. The only thing needed is to change our outlook towards all these things and to incorporate in our practices and advices and our lives also. It is for us also, because we also are suffering from such many issues. And yes, sir. And very surprisingly, you can find a lot of iron in our condiments, the Indian dishes prepared from cumin seeds, having cumin seeds, coriander powder, mango powder, turmeric powder, and mukhwas, dill seeds and fennel seeds. They also have a lot of good iron. So we should preach our parents eating such things from their and including various recipes. Among the cereals and millets, bajra should be propagated. It has got very good iron rather than wheat, ragi, jowar, or whatever other flours are there. People, they have been propagating poha. Poha has got very good iron. No, it doesn't have better iron than what all other things that I have just now told you. And from amongst vegetables, not much iron is there except for peas. You can use dry peas because we are. Our president is in Gujarat. So, એટલે છે ને, best diet would be બાજરાના રોટલા, અડદની દાળ, એમાં બરાબર મસાલા નાખીને અને આ કોલીફ્લાવર લીવ્સનું અને dried peasનું શાક. That would be the most iron-rich recipe. Anyway, now I will first come to the conclusions that I wanted to give you. This is a table that shows the recommendations for fats, carbs, and proteins for different ages that we deal with it, and to give a particular attention to the fats which are more needed in less than 3 years of age, and the proteins also as comparatively are less needed in 1 to 3 years of age. It has got some bearings in the things that I will tell you now. So the new regime can be reducing cereals and increasing legumes and nuts. It increases the proteins and fibers, increases iron and folate, potassium and magnesium, but then there will be some reduction in multivitamin B, especially for those people who eat a lot of fortified grains if it is available. And there are some anti-nutrients like phytates and tannins which can bind with zinc and iron and copper. But then that can be dealt with, and you need to eat some more quantity to give proper calorie density. But then all those things can be very well, those gaps can be filled. So this dish, which is propagated for a 2000 kilocalorie for an average adolescent to adult, and the proportion of the food items here need some change, especially for children more than 3 years and best for adolescents. Just flip the proportion of pulses with cereals. So daily a lot of pulses should be eaten instead of cereals. So cereal staple diet should be converted to pulses staple diet. Ultimately what I found, I calculated that by doing so you reduce the carbs by 30 grams and fats by 1.6 grams and increase the protein by 20 grams. So this is ideal for adolescent. And though there is some almost same calories you find can get it with lot of advantages in future. So new regime, reduce wheat and rice, replace with millets. Increase legumes and pulses, low fat meat or poultry or seafood. Increase green leafy vegetables. Increase low fat milk products. Daily consume nuts and oil seeds. Daily consume wide variety of seasonal fresh fruits and vegetables, and restrict added salts and sugar. How you can do it? Rotis, no to maida, so no pizza, pasta, or any bakery products, naan kulcha. Do not add salts to the rotis. Do not add ghee or oil overlay over the rotis. But then you can reduce the wheat by adding soya flour. So 1/3 should be soya flour and 2/3 should be wheat flour. Or even you can totally replace it with ragi flour, bajra flour, or jowar flour. Best would be bajra and ragi flour. Rice. Say strict no to polished white rice, no to added salts in the rice, no to ghee overlays, and change from the polished rice to brown rice or parboiled rice, or better would be replaced with millets. They taste as good as rice. So barnyard millet is one of the best one amongst them. Amaranth and foxtail millet is the next choice. The millets, they are showing magic. I will not go into very details of it, but we should have handy millets with us in our OPD and show it to our patients. I will show you just now. This is what I keep in my OPD. Here you can see, I show them that instead of rice, white rice, you eat this samo, that is barnyard millet, eat this kang or foxtail millet, this is rajgira or amaranth. You can, instead of wheat flour, you can take more of bajri, ragi, jowar. Maize we don't prefer a lot. Okay. Similarly, you can show to your patients and ask the mothers. Say nowadays mothers, they don't know names of even 10 pulses available in their vicinity, or more than 5 green leafy vegetables. So you have to show them practically. So this is how I show them in my OPD and let them identify things, and they can keep it in their mind. Similarly, keep such handouts in your OPD, and for this is for iron-rich foods. And such counseling really helps. So for increasing the pulses, again after showing, there are only you have to keep in mind that propagate more of chana, soya, moong, or moth and urad. Ask them not to have those with removed husk or milled pulses, and to remove the anti-nutrient effects of phytates and tannins, you can do a lot of soaking and then sprouting and pressure cooking with minimum water, and then fermentation. It all helps to fill in those gaps. Milk. Add, say strong no to sugary or cocoa-based additives. No to full fat milk also. More than 3.5% fat should not be given because it is a saturated fat. Similarly, no, say no to skim milk also. Less than 0.5% fat should also not be given to our children. We need some, they have got fat requirement also. So better is toned standardized 3% milk. And here again you can see a lot of additives can be given from our healthy diet. Sattu, very good tasting. Dry fruit powders, roasted fenugreek powder can taste like coffee, and we have experimented with so many people. Say in last batch of 50 people we had trained, we gave them this fenugreek powder boiled in milk, and they all labeled it as coffee. It tastes as good as coffee. Turmeric, dates, figs, nutmeg, saffron, cardamom, lot of things are available. And if the child doesn't want to take milk directly, you can prepare fresh paneer or hung curd at home. It is equally good and excellent. I'm coming fast to the end. I know I have been given 45 minutes. Similarly, practical advices for fats. Say strong no to trans fat which are there in the industrial products. So packed food, no, no, no. And nowadays, now I have become very dogmatic about very strongly advising against such fats. And whatever saturated fat is there in the diet, it can be replaced with polyunsaturated, unsaturated and monofats by fats of plant sources. Say peanuts, it has got 50% of fats, and these are all most of the polyunsaturated and monounsaturated fats. And they can also be coming from taking good amount of carbohydrate, which are then converted into fats in the body by taking whole grains, fruits, vegetables, and pulses. So coming to the last slide, thanking you, but don't forget to eat variety of fruits and vegetables daily. I think with this, I will end here. Thank you very much for kind listening. And Nehal, I hope I'm in
Thank you,
time.
sir. Yes, sir. It was really nice. Very good presentation. And we are knowing most of them, but sometimes when you reinforce the things, it gets better and better. Especially few new things we got to learn. And it was really nice of you, sir. Thank you, sir. Any questions from the audience?
Okay.
I'd like to entertain some questions. You can unmute yourself and ask questions.
So Prashant has joined.
It was indeed a excellent presentation. So my lots and lots and lots of appreciation for the wonderful presentation, and especially the concept of showing the demo in the OPD. This reminded me of my professor who in his OPD used to have demo of all the food items, and to all the OPD patients he used to demonstrate कि ये खाना चाहिए और ये सब करना चाहिए, which is very, very important. So with this, I sort of think that why can't Ketan ji start a sort of a mission of educating and training on all these demos, food demos in medical colleges
Yes, sir.
to the upcoming, you can say, new generation.
Essence.
Because when we see the medical college curriculum of competence-based medical education and all those things, I mean to say, as sir has mentioned, education has to start from, you can say, either in the schools or in medical colleges at a lower level. Then we will sort of be in a position to prevent diabetes, hypertension more effectively. This is what I feel. Because आगे जाके de-learn करना, पहले गलत सीख लिया और उसके बाद में उसका उल्टा करना is a difficult exercise. So
Yes.
better is to ये नए ICMR plate system and all these things, they are very nice things, and millets and everything. The message has to go down to medical students, nurses in medical colleges. This is what I feel very strongly.
Perfect, sir. Perfect message from you, from such a senior person. Thanks a lot, sir. Now I'll be moving to our next session, the quiz. Umesh, sir, are you willing to say something? Dr. Umesh Khurana,
Yeah.
do you want to say something, sir?
I've spoken whatever I wanted to
Okay, you want?
speak.
Okay, sir. Okay, sir. Okay, sir. They just
I mean
it
to say,
was unmuted, so that's why. Yeah. Thank you, sir. Thanks, sir. Thanks a lot, sir. So we'll be starting with our next session of interesting quiz with Dr. Prashant Kariya. I'll hand over the platform to him only. Dr. Prashant, sir.
Yeah, thank you so much. And thank you to AOP Gujarat, led by Jhankhana ma'am, Nehal Ben, our advisors, Yogesh bhai, Baldev sir, Lata ma'am, everybody. Those who are joining for the first time, because this time the link was shared with many other groups also, that on Kahoot, when you want to join, you have to join it either by scanning this QR code, or you have to open in your browser kahoot.it and enter the game pin 239219. So many people have already been started joining. The quiz questions will start in 5 minutes, and by that time we are thankful to Zorvia for sponsoring the prizes worth 15,000 rupees for all the participants, which will be divided, and 11 participants will be given a prizes. Anybody from Zorvia is joined today? Shailendra?
Yeah, good evening, doctor. This is Chetali from Zorvia.
Yeah.
Mm,
Please, yeah,
yeah,
give your.
can I? Yeah, thank you
Yeah.
so much, sir. First of all, it is indeed my privilege to be here with all of you in this academic program. So thank you so much. And I take this opportunity to thank Dr. Yogesh, Dr. Baldev, Dr. Sandeep, Dr. Lata, Dr. Ketan, who has, I just listened to him for last 10 minutes, but it was a wonderful session to what I could hear. Dr. Jhankhana, Dr. Kirit, Dr. Jagdish, Dr. Nehal, and Dr. Jigin Shah. Yeah, I'm Chaitali from Zorvia Healthcare, sir. First of all, I would like to express my sincere gratitude to each one of you for being an integral part of eGurukul, which is a wonderful academic initiative by AOP Gujarat. Programs like this truly strengthen our commitment to continuous learning and better patient care. I also take this opportunity to extend my special thanks to Dr. Prashant for conducting this engaging and thought-provoking quiz. Sir. And I would also like to take this opportunity to share a proud moment from Zorvia Healthcare. So with the encouragement and the support of doctors like you, we have achieved a remarkable milestone. Within the 3 months of debut, sir, Zorvia Healthcare has been ranked among the top 100 pharmaceuticals company in India, securing the 99th position. So that has been a great feat which we have achieved in last 3 months. So for this, if I would say, this is not just a ranking, but the reflection of the trust that the medical fraternity has shown in us, and for the young organization which is driven by trust, innovation, and accessibility. So at Zorvia, we are committed to supporting scientific exchange, continuous medical education, and initiatives that help clinicians to stay updated with evolving medical knowledge. So we look forward for partnering with you in many such initiatives, sir. And thank you once again for your valuable
Yeah,
time,
so
trust, and continued
thank you
support.
so much.
Have a wonderful evening, sir. Thank
Yeah,
you so
thank you
much.
so much. So we are just starting the quiz,
Yeah,
and
thank you, sir.
few people are messaging me, but then this is just been started. The quiz has been started. The first is simple question, which is a poll question for everybody who has actually been joining first time. This type of thing will come. NEET officials after the controversy be like, सब कुछ सीखा हमने, बचना ए हसीनो, ये कहाँ आ गए, ये क्या हुआ, कैसे हुआ, and तड़प तड़प के इस दिल से. So you will be seeing 4 options on your screen and you have to answer it. And in 20 seconds, we almost have 53 answers and everybody's answers are correct. But the real quiz now begins and I wish everybody all the best. And please be remain till end and then participate in this. So all the best to everybody. The real quiz starts now. The first question, which dietary modification is recommended in celiac disease? Gluten-free diet, ketogenic diet, low-protein diet, lactose-free diet for life. 5 seconds and 65 answers. Good. So out of 75 answers, 69 are perfectly right. That gluten-free diet is the correct answer. Now the beauty of this Kahoot, those who are playing for the first time, even if your answer is right, it depends on the speed at which you give an answer, and the correct answer was given fast by Shivani. If I'm not wrong, she is a consistent player. Meghna and R. Hitesh and Mini. Fine. All the best. Next. Ketogenic diet works by which of the following mechanisms? Modulation of glutamate neurotransmissions, ketone production, free fatty acids, and all of the above. And out of the 77 answers, the 58 are right. It is all of the above mechanisms. And those who have attended Nitish Vora's talk must know this. So thank you so much, Dr. Nitish. Next, a double point question. Which parameter best indicates successful nutrition rehabilitation in child with severe burns? Positive nitrogen balance, normal serum sodium, declining serum albumin alone, and low blood glucose. So whenever a patient of burns is there and you are doing a nutritional rehabilitation, in that case is few things which are happening, but if you find a positive nitrogen balance, and again out of 85, 64 are correct, that if positive nitrogen balance is there, that means it is a successful nutritional rehabilitation. Good going, team. And now we have Meghna, Hitesh, and QWERTY. Okay. Which diet is recommended in type 1 diabetes mellitus? Protein only, high fat, no carbohydrate, or balanced diet with carbohydrate counting? So in 10 seconds, 84 answers are already been there. And we are waiting for a few more. And the correct answer, yes, almost everybody is right. It is a balanced diet with carbohydrate counting. So in the last session also, we just said that in a type 1 diabetes, it is not about that you cannot have a carbs. You can have all the balanced diet, but most important thing will be counting the carbohydrate and adjusting the insulin dose accordingly. So gone are the days in which we used to say that a type 1 diabetes cannot have this, cannot have this. They can have everything in a balanced way, but most important thing, count it and then adjust the dose accordingly. So Hitesh is at the top. Coming to the next. Which trace element deficiency causes dermatitis, alopecia, diarrhea, and poor wound healing? Copper, selenium, chromium, and zinc. We've reached to around 86 answers, and out of that 82 are correct. It is zinc. And that's why we say dermatitis, dementia, and diarrhea. That all things which have been happening is because of zinc. Okay, coming to the next. Which therapeutic diet is used during the stabilization phase of severe acute malnutrition? See, it's a stabilization phase. F75, high protein, F100, and ORS only. So this will be answered most correctly by our postgraduate students because they know that in this phase, we start with F75 and then we increase to F100. So the meaning of F75 is 75 calories per 100 ml and F100 is 100 calories per 100 ml. So in a stabilization phase, start with F75. That is most important. Okay, SG has come to top now. Which amino acid should be restricted in phenylketonuria? A methionine, a phenylalanine, a tyrosine, or a leucine? So PKU is a condition in which this amino acid should be restricted, and out of 86 answers, 69 are correct, that it is phenylalanine. Perfect. A refeeding syndrome is most commonly associated with rapid administration of water, carbohydrates after prolonged starvation, fat only, or protein only. Now this syndrome is...
prolonged starvation.
Yeah, please don't answer, sir. We have to click and just see it because your answer is a correct answer, which gives points to other people. You have to play it on a Kahoot, not on Zoom platform. If you're joining for the first time, then remember that we are joining through Kahoot app. On the left-hand screen, you can just see that kahoot.it is the platform on which you have to join and enter the game pin. That is 239219. The same link has been given in a chat also. Yeah. Next. Children with congenital heart disease often require high calorie feed, low protein diet, reduced calorie intake, fat-free diet. So we are stuck to 87 numbers, and 87 out of that 70 are correct. That in case of a congenital heart disease, we often require a high calorie feeds because we don't want to give more volume, but calorie requirement has to be met. And for that, a high calorie feed should be there. So which is perfectly right. And now the Zen has come to the second position. TPS is at the first. Remember, all those who are at the top, please share your real names at the end of a quiz, and that will be beneficial to all of us. Next. So sorry. Which stress element deficiency is most commonly associated with prolonged TPN without supplementation? That is manganese, fluoride, zinc, and chromium. You have to select only one. I don't know, the Kahoot has taken multi-select, but you can select only one. Yeah, the correct answer is zinc, which is there and rightly been selected by 55 people. Yeah. Which mineral supplementation is routinely required in Wilson disease? Again, calcium, iron, zinc, or copper? To reach to magic number 87, and next, I think out of that 47 are right. That zinc is the thing which is required in Wilson disease because this will decrease the absorption of copper, which has been happening. So it has to be supplemented. Next, which nutrient restriction is essential in galactosemia? Protein, lactose and galactose, fat, and fructose.
Fructose and galactose.
Sir, please play it on Kahoot because everybody is playing on Kahoot, and if you answer, yeah, so out of 87, 82 are perfectly right. It is lactose and galactose, which is to be restricted. A child with chronic liver disease is most likely to require protein-free diet, low-fat diet, low-calorie diet, high-calorie diet with adequate protein.
High calorie diet with adequate protein.
Ahmed Karim sir, please do not answer on Zoom. Yeah. So the 72 people are perfectly right that high calorie diet. So in case of a chronic liver disease, we don't say the protein free diet should be there. It should be with adequate protein. Only in case of acute or chronic diseases at that time, sometimes it has been restricted. Next, which amino acid becomes conditionally essential in phenylketonuria? Leucine, glycine, tyrosine, or lysine? So out of this 85 answers which we have received, 86 answers, the correct answer is tyrosine, which has been given by 65 people, and it is correct. And it is changing the leaderboard. Harshu is still at the top. Okay. Ketogenic diet is specifically indicated in which condition? A G6PD deficiency, GLUT1 deficiency, phenylketonuria, or carnitine deficiency disorders. Again, this is a question taken from the last session of Dr. Nitish Vora, and he has clearly showed us the conditions in which the ketogenic diet has been recommended, and it is GLUT1 deficiency is the correct answer. Sid is coming to the third place now, followed by Swati and Raj. Next, which vitamin supplementation is routinely recommended in children with cystic fibrosis? Fat-soluble vitamin A, D, E, K, vitamin B12, vitamin C, or folic acid only? This was one of the simplest question which have been kept. that in case of a cystic fibrosis, there is a need of fat-soluble vitamins. So out of 86, again, 80 are correct. That EDEK is the correct answer. Okay. Which vitamin supplementation is essential in children receiving prolonged total parenteral nutrition? Of vitamin D only, vitamin C only, no supplementation required, and complete vitamin and trace element supplementation. So when the child is on prolonged TPN at that time, it is most important that you supplement with all vitamins and trace, because there is no vitamins and trace elements in that. So good audience, out of 86, 78 are right. And we do have a mitochondria who is showing love to our quiz. Thank you so much. A double point question. The hallmark biochemical abnormality in refeeding syndrome is hyperuricemia, hypercalcemia, hypophosphatemia, and hypernatremia. Because this is a double point question, we are given a double time, 30 seconds time for this. And yeah, and the correct answer in this case is hypophosphatemia. Again, impressively good number of people, 56 have said the correct answer. Swati is coming back to the board at a third number. Which dietary advice is appropriate in nephrotic syndrome with edema? Salt restriction, high salt diet, complete protein restriction, fluid restriction in all patients.
Restriction.
Yeah, sir. So the correct answer is salt restriction, which has been perfectly identified by almost all. Sid is coming to second place. Double point question. A child with cystic fibrosis has poor weight gain despite adequate calories. The next most appropriate intervention: gluten-free diet, pancreatic enzyme replacement therapy, restrict dietary fat, protein restriction. Remember, this is a child with cystic fibrosis, and despite all things is not gaining weight. And in that case, the most appropriate intervention will be 78 out of 88 are correct, that pancreatic enzyme replacement therapy, PRT, which we say is to be done. Raj is coming to the leisure board. Which nutritional deficiency is common in children receiving long-term anticonvulsant therapy? Vitamin C, vitamin B12, vitamin K, vitamin D. So any child who is receiving anticonvulsant, in that case, the metabolism of this vitamin is being changed, and that is vitamin D. So we have to supplement it. So that is vitamin D deficiency is the correct answer. And now do we have a new board leader, Sid, followed by Swati. A double point question again. Which diet is recommended in maple syrup urine disease? Lactose free, low fat, low branch chain amino acid, or gluten free diet? So this all diets are recommended in different conditions, but in MSUD, the low branch chain amino acid is recommended. Gluten free is for the celiac, lactose free is for the lactose intolerance, or a child with different disorders. So that is there. Okay. Coming to the next question. Which diet is best for most neurological conditions? Atkins diet, ketogenic diet, healthy balanced diet, and GFCF diet. This is slightly tricky question that most neurological condition, which diet is best? And again, I think in last Thursday, Dr. Nitish has discussed this, that it is not the ketogenic diet, but the balanced diet that is to be used, because this diet is having a typical role in typical neurological things, not in the most neurological conditions. So this was been discussed last time also. Next, a child with severe burn has increased requirement of calories in protein, sodium restriction, fat only, carbohydrates only. So whenever a child is having a burns, at that time, we say the child should be given a diet which is rich in calories and protein, and correctly said by almost 84 people, that is perfect. Which vitamin deficiency is most likely after prolonged cholestasis? Vitamin B6, vitamin C, vitamin K, or vitamin B2? This is a simple question which has been given a double points just to make it more interesting. So in case of a cholestasis, usually there is a deficiency of fat soluble vitamins, and that's why vitamin K deficiency is commonest. Next, which dietary recommendation is appropriate in persistent diarrhea? Continue breastfeeding and age appropriate feeding, fruit juice only, water only, and stop all feeds. So Ketan Bhai has also said something about this. So in case of a persistent diarrhea, most important thing, because the cause is not related to breastfeeding, it has to be continued, and age appropriate feeding has to be continued. Vijendra is climbing. This time we are having so many different leaders which are happening. And a child with acute viral hepatitis should receive normal balanced diet according to appetite, fat-free diet for 6 months, protein restriction in all cases, and complete fasting. So nowadays they say in a case of acute viral hepatitis, a normal balanced diet according to the appetite will be a best, and there is no need of a restriction. Ra is coming to the third position. A nutritional management of acute pancreatitis in children includes total parenteral nutrition for every child, early enteral feeding when tolerated, prolonged fasting in all patients, and high fat diet. So in case of a pancreatitis, now we say early enteral feeding when tolerated is the best thing, and that is to be started early. So that is most important. Coming to the last few cases, which of the following best reflects successful nutritional rehabilitation in severe acute malnutrition? Appetite decreases, height increases by 5 centimeter per week, hemoglobin normalizes within 24 hours, and weight gain more than 10 gram per kg per day during rehabilitation. And this is one of the discharge criteria also, that if a child is gaining more than 10 gram per kg per day during rehabilitation for 3 continuous days, we can discharge the child. And good to see out of 83, 76 are correct. Coming to the third last question. A child with severe CP has a recurrent aspiration during oral feeding and poor growth. Best thing to do is gastrostomy, PPN, oral nutrition supplementation, and permanent fasting. So this is correct, a gastrostomy. And for a change, we have shown the correct answer into the figure also. If you've seen the figure, the gastrostomy tube is been shown in the picture also. In a child with severe burns, the nutrient most important for wound healing is protein, sodium, fluoride, cholesterol. Yeah, so the correct answer out of 84, 80 are correct. It is protein. So good audience who is participating nicely. And the last question for the day. All the best. A SAM child develops edema after rapid initiation of high calorie feeding. The most likely diagnosis is hepatitis, congestive heart failure, refeeding syndrome, acute nephritis. And correct answer is refeeding syndrome, which is correct. So thank you so much to the team. And before we declare the results, I just want a poll opinion of everybody. How was the quiz? Very easy, medium, or hard? In this, at least we should have all were giving answers. And let's see the result. So it is medium. 5 people said very easy, 14 said easy, and 10 people said it's a hard. So almost in each question, we were getting almost 80 plus answers. So 10% people find it hard. So that is okay, but 90% people said it is okay. So here is the podium winners. And when we declare the podium winners, the requisite is we'll be giving prizes to top 11 people. You to take a screenshot of your score numbers and send it to aopgujarat@gmail.com or to my mobile number that I'll be sharing. And we will be transferring the amount, the price next 10 working days. Thank you so much for participating. And here is the result. The third rank was secured by with 34,000 points, Swati. The second with 34,770, Vijendra, and 35,918 points. And Raj is the winner. So congratulations to Raj. And seeing the others winners, I'm just three winners, but we are going to give prizes to couples. And
प्रशांत लीडर बोर्ड आ गया 1 to 11. Lata, the leaderboard was shown.
No, ma'am. It was
No,
not shown.
Prashant has left. I think
I
there
think
is
something
some.
happened to his server because suddenly stopped.
Yeah. So we will share the leaderboard. That's not a problem. If Prashant joins again, he will share the leaderboard screenshot so that all the winners will have their positions in the leaderboard. So let's wait for the Prashant to come. By that time, thank you so much everyone for the active interest and taking participation in the quiz. I could see many of the senior doctors also. Dr. Jalil Ahmed sir is always here and he is always encouraging every one of us with each and every e-Gurukul episode. Welcome, sir. Dr. Grivita is here Thank you, Grivita, for being here, a senior pediatrician and a lovely lady from Maharashtra. Many other friends and those who joined Kuhut and leaving this platform also, I thank them very much. Thank you, Zorbia, for providing this constant support and the motivation for the quiz. So thank you so much. Hi, Grivita.
Thank you. I
Prashant,
think,
yeah.
I think my screen is again visible. In between, the connection was lost,
Yeah.
and these are the top 11 winners. You two again take a screenshot of this. We are taking a screenshot. Raj, Vijendra, Swati, Rajesh K, TPS, Eddie Bravo again, consecutive fourth time is getting the prize. GVM, GBP, Hitesh, Merin, and Harshu or Chetu. I mean, this are 11 winners. You all have to send screenshot of your this to aopgujarat@gmail.com. So that will be official thing, and we will be actually giving the prizes in next 10 days. Thank you so much again to our team. Sorry for the network which went at the last point. Yeah.
Thank you, Prashant, conducting the quiz so swiftly every time, and the people always find your quiz very interesting. You always take a poll, it is coming to moderate most of the time. That is your success. Thank you so much. Thank you, Debashish sir, for being here. Thank you so much. Ketan Bharadva sir is still here. He guided us through such a wonderful expert talk, and it was so many things that even I learned today with the micronutrient and everything. We have started replacing the wheat with the other millets, but yes, it's need a constant effort. So thank you so much, Zorvia. Thank you, Jhankhana madam, and thank you all, Dr. Charul Mehta madam. Thank you so much for being here. She is always here to support all the students and encouraging everyone. Rajesh sir,
Thank you, ma'am.
Dr. Rajesh Kulkarni. Thank you, sir. Thank you being here.
Thank you, Nehal Ben.
Very nice quiz, I must say. I enjoyed it.
Thank you.
Yes.
Thank you.
Ahmad Karim sir, please next time join on Kahoot. Don't answer on Zoom because your answers were right, but I think you're answering on Zoom. You have to answer on Kahoot. Yeah. Thank you so much. Yeah. Good night.
Good
Good
night.
night,
Good
Good
night,
night.
all.
Good night,
Good night,
everyone.
everyone. Bye.
Bye.